One of the other abstracts that we presented at a different meeting is really interesting is the treatment of high triglycerides. High triglycerides have been very difficult to treat. The medications are really not all that effective. And we've seen an amazing response in triglycerides with the protocol. We have an abstract from a couple of years ago where people went from 201 down to about 70 or so after 12 weeks on the protocol. So I think the carbohydrate restriction really improves the triglycerides. Obviously triglycerides are one of the major risk factors for the development of ischemic heart disease, coronary disease, or atherosclerosis, or hardening of the arteries. So we see a really nice response in triglycerides with these protocols, and we've documented that multiple times in multiple different ways. When we get those results, then we can tell the patients, hey, you've really lowered your risk of developing heart disease. Oftentimes their blood sugar gets better. You've either improved your diabetes or lowered your risk for developed diabetes if you're pre-diabetic. So you can give them a lot of real positive feedback that they've really improved their long-term health and their likelihood of developing problems. We see in some of our really large patients, we've seen some really nice response with edema. In other words, I can think of a couple of younger gentlemen that were really struggling with leg swelling, and they'd be on 200 milligrams of furosemide every day and just not being able to get it under control. And usually within 4 to 6 weeks or so, we can get them off most of their water medications. So that's really gratifying. Guys can it's simple things, putting your shoes back on or getting shoes that you can wear that really are helpful. I think one of the things that's important about these results, when you look at blood sugar results, blood pressure control, we have a very specific protocol for withdrawing medications. So we stop a lot of diabetic medications on day 1, and then a lot of them after a couple of weeks. So these results that we see when we see better blood pressure, and especially better blood sugar, hemoglobin A1C, those are on less medications. Insulin is withdrawn usually with the help of the primary care physician, either the endocrinologist or the primary care physician. But a lot of the other oral hypoglycemics, we withdraw right away. So these improvement in numbers is seen on less medications. Blood pressure medicines, we see the patients every week. We monitor their blood pressure, so we usually taper those off individually, but most people are going to be on less medications for their blood pressure as well. So when you're seeing good blood pressure results, you're seeing that on less medications, which is obviously very gratifying. If we can treat something with lifestyle, diet, it's much more satisfying than giving them the problems and costs and complications of medications. We've seen improvement in asthma. I'm not saying that we treat asthma with ketogenic diet, but we see other inflammatory things, gastroesophageal reflux or GERD gets better. Asthma is one that we see quite a bit. Personally, I'm off my asthma inhalers for the last 3 years. So I think that ketosis, initial ketosis, is really very helpful in getting people to follow the protocol and lowering the inflammation state. Yeah, type 2 diabetes is obviously the impending healthcare disaster of the 21st century, right? With obesity. In Wisconsin, where I live, 39% of patients are obese, not just overweight, but 39% of people are obese. And obviously obesity hugely raises risk for type 2 diabetes. I think there's 30 million type 2 diabetics in the U.S. at this point in time, or
yeah, right about
30 million type 2 diabetics in the U.S. at this point in time, and that number is obviously predicted to go up as people age and as the obesity crisis or the obesity pandemic progresses. And what we know about type 2 diabetics with heart disease is they do a lot worse. So if you have diabetes, your outcome from heart trouble is a lot worse than if you don't have diabetes. So controlling diabetes, controlling blood sugars, which helps to control liquids or lipids, is just crucial to the outcome of our patients. If we can't get their diabetes under control, we can't get their triglycerides under control, we can't get their lipids under control. Oftentimes it relates to blood pressure. You can't get their blood pressure under control. So it's really hard to improve somebody's prognosis or lower their risk for recurrent events if they have uncontrolled diabetes. So it's really fundamental to what we do. And when their weight's really uncontrolled, it's very hard to control their diabetes.